All right. Welcome. Good morning. Happy Saturday. Happy Saturday. Good morning or good afternoon. Welcome to today's program. Welcome to today's program. All right. Today I'm going to be discussing, or we shall be discussing, the 4 stages of diabetic retinopathy. We are back to this topic once more again. I think earlier this year we did it, or last year we did much of retinopathy. So we're back to it once more to discuss the stages of retinopathy. All right, you guys know what is retinopathy is. One of the complications of diabetics. It has to do with your eyesight. So we're going to be touching on it again. What are the stages of retinopathy if you're a diabetic? So we have 4 stages. So we shall be discussing the causes, or the stages, the symptoms, the diagnosis, the treatment, prevention, the complications, and then want to see a doctor if you're having issue with your eyesight, and once again if you're a diabetic. So join me on this morning's or this afternoon or this evening program, depending where you're watching from, to learn the stages of the diabetic retinopathy. All right, that has to do with your eyesight, your vision. If you're a diabetic, all right, in order not to lose your eyesight or have an issue with your eyesight, it's important to understand that too much of sugar levels in your bloodstream can also cause you damages to your eyesight. It has to do with your retina, right? So we shall be looking at the 4 stages of diabetic retinopathy. Okay, so join me this morning or this afternoon to learn the stages. Once again, please indicate to me where you're watching from once you join the program. Indicate to me where you're watching from. You're welcome to today's program, Managing Diabetics or Living with Diabetics. Okay, so we're going to just wait for about a few minutes. I'm going to wait for about a few minutes and then we'll start the program. Okay, I'm going to wait about a few minutes and then we'll start the program. Okay, let me do something. How are you guys? Welcome to today's program. I'm waiting for everybody to join, to come online, and then we'll start. Okay. How are you guys? You are welcome to today's program. All right, let's go to. Please indicate to me where you're watching from. I'm just waiting for everybody to come online and then we'll start the program. All right. Okay, let's see what is happening here. Let's see what is happening here. Okay. How are you? How are you guys doing? All right, that is done. Let's keep going. All right, let's keep going. Okay, let's start. And let's start. Let's not waste time. Notice has been sent. As I said, you are welcome. Back to this topic. We've discussed these topics earlier this year or last year. We discussed about we discussed live, and we have a lot of several videos on my page about diabetic retinopathy. Okay, diabetic retinopathy. We all know that it's also a complications of diabetics. Okay, it has to do with your eye vision. Okay, it has to do with your eye vision. So we're going to be looking at, in today's program, we're going to be looking at the stages of diabetic retinopathy. Okay, what happens? What are the causes? How do you identify it? The causes of diabetic retinopathy. If you have started losing your eyesight, okay, or either you are total blind or partial blind. We're going to look at the causes, we're going to look at the stages, and also we're going to look at the symptoms, and then how to diagnose it, also the treatment, and then the prevention, and other complications that accompany it, and then when to see your doctor. If you're a diabetic, you have to be cautious of losing your eyesight, and that is why it's important at all times to make sure you control your sugar level. Everything has to do with controlling your sugar level to keep it in a target range to avoid all these complications. Because if you fail to control your sugar level over a period of time, or you ignore it and continue living the kind of lifestyle you've been living without even taking your doctor's advice, or you're not even taking your medications, or you're not even doing those things they ask you to do, then you are inviting a problem to your eye. Okay? You might lose your eyesight. It might be total loss. It might be partial loss. So, but at the end of the day, it is one of the complications of diabetics. So we're going to be discussing what is diabetic retinopathy. Okay? What is diabetic retinopathy? All right. All right. So I'm going to be sharing a link for those who want to join the program live. If you want to ask your question on the live, if you want to join me live on today's program, I'm going to be sharing a link now. Use that link to come to the live video and then ask your question or contribute, or if you have anything to say about your diabetic situations, you are welcome. So I'll be posting the link. You have to use this link to join the program live. All you have to do is to download it on your iPad, or your phone, or your laptop, your iPad, and then open it and then follow the instruction on how to join the program live. Okay, so the link is in there. Regina, you're welcome. Okay, you are welcome. So I've posted the link. I've shared the link to use to join the program live. So as I was saying, we shall be discussing So we shall be discussing the stages. There are 4 stages of diabetic retinopathy. Okay. Now, diabetic retinopathy is an eye disease, okay, that affects people living with diabetics. It is an eye disease that affects people living with diabetics. It develops when high blood sugar damages the tiny blood vessels in the retina. It has to do with your retina. Retina is the core, is everything that has to do with your eye. Control everything have to do with your vision control, anything that have to do with your eye, what you see, what you interpret, it is your retina. If anything damages the retina, then it's either you are totally blind or you are partially blind. So for anything, you have to make sure anything that is going to disturb or destroy or damage that retina, you have to avoid it at all costs, because retina is what controls your central vision. Everything that have to do with your vision have to go through the retina. That retina is very, very important. So you got to be very careful, okay, to make sure their retina is not damaged. So diabetic retinopathy is an eye disease that affects people living with diabetics. Okay, it develops when your sugar level damages the tiny blood vessels in the retina. So when you have too much elevation in your sugar level and you're not controlling your diabetes, it goes to damage the tiny vessels that are connected to the retina. This causes a variety of symptoms like blurry visions and vision loss. Okay, so you got to be wary and very careful in how your retina function by start dealing with the control of sugar level if you're a diabetics. Now, it is a progressive disease that may lead to irreversible vision loss. Once you lost your eyesight, that is it. You cannot retrieve it back. So it is important to have a regular eye exam. If you're diabetics, I've told you guys how often you should have your regular eye exams. And then if you have a good doctor, it's going to diagnose the condition early if you start having an issue with your eyesight and the slow in progression. It has to do with once you start noticing any problem that have to do with your blurry vision, your central vision is now degrading, and your diabetics. If your doctor diagnoses it in time, okay, all they have to do is 2 things: is either to slow its progression or to delay it or to stop it. The earlier, the better. The earlier you get a symptom and start treatment, you have a variety of options. The earlier you got it at the 4th stage, you have an option of either delaying the progression, slowing the progression, or stop it right there and there, and then start correcting those things that causes you to have those problems. So that is why it's important as a diabetics to make sure you check up, you go on an eye exam every year, depending on the status of a diabetics. Some go for their own every 6 months if their conditions are very severe. If you're managing your sugar level constantly very well, you don't need to go every 6 months or every 3 months. You can delay it every year. I go my own every year. Okay. Some people go their own every 3 months, 6 months, depending on the severity of their diabetic situations. So be very careful anything that will affect your retina. Okay, so that is what we call diabetic retinopathy. Analu, you're welcome. So that is what we call diabetic retinopathy. So so I haven't finished the intro. Let's go. So let's look at what causes diabetic retinopathy. Okay, what causes diabetic retinopathy? Okay, I've told you guys is if you're diabetic, you're not controlling your sugar level. Okay, that is the cause. When you have too much elevation in your sugar level and you're not controlling it, you're not doing anything about it. Okay, So what causes diabetic retinopathy? Glucose or blood sugar is the main source of energy. I've told you guys why glucose is classified as your main source of energy, how it starts. Okay, we need that glucose. Okay, we need that glucose as our source of energy, and there's a process. I've explained it several times when it can be classified as a source of energy. Now, when that source of energy becomes too much, circulating in your blood can be harmful to the body. When it stays within the target range, okay, it is your source of energy, because now your cells of your body is sensitive to insulin. It's not resisting insulin. That means the cells of your body, your muscles, is accessing those glucose to be used as your source of energy. Now, when it is excess, that is when it is harmful to your health. So when you have excess sugar in your blood, moving around, floating around in your system, that is when it becomes helpful to all your entire body. All right. So the pancreas, okay, releases the hormone insulin, which helps cells absorb glucose for energy. Now, in the case of diabetes, okay, the body doesn't make enough insulin or doesn't use it properly. This causes glucose to accumulate in your bloodstreams. I've said it several times. You guys know how it started. Now, consistent levels of high glucose levels can affect different parts of your body, including the eyes. So when you have too much sugar level in your bloodstream, floating around, your body is resisting insulin, okay, then that is when it is harmful to your body, and then start damaging those tiny blood vessels, the nerves that are connected to your eye tissues and all parts of your body, and then or the major organs of your body, and start damaging it. So diabetic retinopathy doesn't only weaken or damage the blood vessels in the eye, it can also cause development of new abnormal blood vessels in the retina. So apart from damaging the tiny blood vessels and the nerves that are connected to the retina, it also starts to develop new ones. And those new ones also causes problems to the retina that could make you to have a total loss or a partial loss. So in a short form, what causes your diabetic retina is when you have too much accumulation of sugar levels in your bloodstreams. When too much sugar level is floating in your bloodstreams, and then they start damaging those tiny nerves and blood vessels and then the major organs of your body, and then you start having issue with your eyesight. All right. So those are the causes of diabetic retinopathy. Now we're going to be looking at the stages of diabetic retinopathy. I told you guys we have 4 stages of diabetic retinopathy. Okay, and they are in the sequence. They start from stage 1 to stage 4. It cannot start from stage 4 to stage 1. It starts from stage 1 and progress to stage 2, progress to stage 3, and then progress to stage 4. Okay, so we're going to look at those stages. And one thing you have to understand is that, okay, as I said, the earlier the better. The earlier you notice the symptoms and start treatment, the better, because the earlier you notice it, you have various options to treat or to delay or to stop such symptoms from causing further damages to your body. But if you allow those symptoms to progress from stage 1, because when it goes to the next stage, you are losing another option. So for instance, if you didn't find the option on stage 1, in stage 1 you have variety of options because it's an early stage. It has not caused too much damages. If you catch it on stage 2, you might lose some options in stage 1. You might not have it in stage 2. Now, if you go to stage 3, you might lose those options you have in stage 1 and stage 2. They see that your options, as it progresses, your options narrow. Okay, so that is why not only in retinopathy, in terms of, let me just generalize it, in terms of illness or diseases, the earlier the better. Any disease you have, the earlier you notice it and start treatment, you have options. But if you tend to ignore it, if you tend to ignore those symptoms and allow it to progress, the more it progresses, the lesser you have options. Okay, so that is why it's important to treat the symptoms at the beginning when it is in an early stage, because you have various options, and then your chance of survival is great than when it goes to the higher stage. You're welcome. You're welcome. All right. So, what are the stages of diabetic retinopathy? I say we have 4 stages. Now, diabetic retinopathy is a progressive eye disease classified by two types and 4 stages. Okay, we have 2 types and 4 stages. The 2 types are non-proliferative and proliferative classifications. We have the non-proliferative and the proliferative classifications of eye disease. Those are the 2 types, and then we have the stages. All right. Just hold on. I'm coming. All right. So we have the 2 types as the first one is non-proliferative, and then the proliferative types. Okay, those are the 2 types, and then we'll have the 4 stages. Okay, the non-proliferative refers to early stage of the disease, while the proliferative is an advanced form of the disease. So it is better to get it when it's at non-proliferative stage. That is the early stage. When it goes to the advanced stage, it becomes worse. Okay, now let's start to stage 1. Okay, let's start with stage 1. Stage 1 is the mild non-proliferative diabetic retinopathy. Okay, we're talking about the stages of diabetic now, retinopathy. Let's go to stage 1 of this is stage 1. Okay, mild non-proliferative diabetic retinopathy. Okay, that is the stage 1. Remember, anything non is an early stage. When it becomes proliferative, it becomes an advanced stage. So if you're going to get the symptoms when it is on mild, on stage 1. It's an early stage. Okay. Now, this is the earliest stage of diabetic retinopathy, characterized by the area of swelling in the blood vessels. On this particular stage, you have swelling in the blood vessels of the retina. Okay, these areas of swelling are known as the microaneurysm. Okay, this swelling that occurs around the retina is known as the microaneurysm. So in this stage, there's a swelling in the blood vessels. So this is the early stage. Now, the small amount of the fluid can leak into the retina at this stage. So you have a little amount of fluid leaking into the retina. I don't want, at this stage, I've said it in the video I did in the past, you don't want fluid leaking or blood leaking into the retina. If there's a video that I posted on my video I did, and then I did it with a diagram. I showed you guys when a blood is leaking into the eyesight. It's in the page there. Okay. You could see some people, you could see some blood at the corner of their eye or beneath their eye. So on this particular stage, okay, you have swelling in the blood vessels of the retina, and then the swelling is known as microaneurysm. Now, there's likelihood of fluid that can leak into the retina at this stage, or triggering swelling of macula. You guys know about macula. We did about macula, a lot of videos about macular edema. This is an area near the center of the retina. Now, I've told you guys, retina is what controls your central vision. Anything that have to do with your vision. Anything that have to do with your center, what your eye can see, interpret, read, and send to your brain have to do with your retina. Now, inside that retina, at the center of that retina, there's something we call the macula. Macula is what is responsible, the focal point that sees something and then send it straight to the retina, and within seconds your brain interprets it. So it's like your pancreas. We all know about pancreas. You want to say, oh, pancreas, you are okay, your pancreas is damaged, that's why you are not producing insulin. But people don't know that pancreas is not what is responsible in producing insulin. Inside that pancreas, there's something we call the beta cells. Beta cells is one located inside the pancreas. That is what is responsible in producing those insulin that your body needs to regulate the amount of sugar level in your bloodstreams. Now, when it comes to your eye, retina is what is responsible for your central vision. Anything that has to do with your vision is your retina. You lose your retina, that is it. Now, the macula is located in the center of the retina. That is what captures whatever your eye can see. It goes through the macula. And as soon as that macula captures it, it sends it straight to the retina. And retina within seconds send it to the brain, and the brain will interpret it within seconds and then send it back to you. So now, at this early stage of non-proliferative diabetic retina, there's a swelling around your retina. We call it, microaneurysm. Then there's a likelihood of fluid leaking into the retina at this stage. Now, triggering swelling. Those leaking is what is triggering the swelling of the macula. This area is near the center of the retina. So at this stage, at this early stage, there's the possibility for you to stop that leakage into the retina, clean it up, stop the leakage into the retina, and then now you have to now to delay or no more further damages to the blood vessels, because now you know that there's a leakage. Don't tell, hey, listen, control your blood sugar level, because that is what is causing those leakage. So in treating it, there's a fluid that will put in your eye. Okay, depend on this stage. That's at the early stage, there's a lot of options that have to go through your eyes, like an eye drop. Okay, that have to go and then through your blood vessels and then block those leakages. And then if it depends how bad the fluid leakage is, they can clean up your eye and remove all those things. You go on a surgery, through a laser surgery, they remove all those. And so at this early stage, one, you have several options to stop the leakage, to stop the swelling. And then at this stage, you can still see, because it's an early stage. Okay, so that is mild non-proliferative diabetic retina. Okay, at this stage. Let's go to stage 2. So as I said, it starts from stage 1 up to stage 4. It's a progressive conditions. Okay, the early stage you have options, but when it gets to the last stage, that's when you start losing all the options, and then the chances of you retaining your eye is minimal. So let's go to stage 2. Stage 2 now becomes moderate non-proliferative diabetic retina. So you can see from mild, it progressed to moderate. Okay, so this is stage 2, moderate non-proliferative diabetic retina. Okay, now remember in the stage 1, there's a swelling in the blood vessels of the retina. Okay, now, and also there's a possibility of fluid leaking into the retina, triggering the swellings of the macula in this stage 1. You're going to see the difference between stage 1 and then the stage 2. On stage 2, there's an increase in the swelling of the tiny blood vessels that start to interfere. See, in the stage 1, there's a little fluid leakage, but when it goes to stage 2, there's an increase. In stage 2, there's an increased swelling of the tiny blood vessels start to interfere with the blood flow to the retina. Because of the increase in the swelling of the tiny blood vessels, it interferes blood flow to the retina. Blood must flow to the retina. Anything that it's like your heart pumps blood. It has to send it straight to your brain before it goes to any other part of the body, because it carries oxygen. Anything that deprives your brain from getting oxygen, that is why you start losing your breath, and then all of a sudden you die. If your brain cannot get oxygen, you start losing your breath, and then gradually you faint, your organs start shutting down, because there is something that is not blocking the blood to flow from your heart to carry oxygen to the brain. That's when we're talking about you have a stroke, high blood pressure, because of Your cholesterol issues, your arteries are clogged, they are tiny. Now blood cannot carry oxygen to the brain. And when oxygen is not reaching to your brain, there's likelihood of death, heart attack, or you faint, or stroke. So the same thing when there's an increase in the swelling of the tiny blood vessels. And then because of that increase of the blood vessels, it interferes the blood flow to the retina. And when blood is not reaching the retina, you see that you start gradually losing your eyesight. Okay? That prevents proper nourishment because blood must reach to the retina. It's like you have to feed the retina with the fresh blood. It carries oxygen there and other nutrients that it needs to nourish the retina. It's like a joint. You know this car, your door, there are hinges in your door. You know, there are hinges. Sometimes when you open your door, your window of your car, it start making noise. You start hearing a squeaking noise. Then when you all put an oil, grease it with oil, you see that those noises disappear. It now open firmly. The same thing applies to the retina. Blood must reach to the retina to nourish it because in that blood, it carries a lot of nutrients and vitamins and hormones that your body need, that the retina need. So if the swelling interferes with the blood flow to the retina, it prevents proper nourishment to the retina, and this causes an accumulation of blood and other fluid in the macula. So that due to the increase of the blood, swelling of the tiny blood vessels, okay, then there's now accumulation because now remember the blood is leaking into the retina. There's an accumulation now into the around the macula. So that is the stage 2. So from stage 1 is mild. There's a little fluid liquid into the retina, and it causes a swelling microaneurysm. Now, if you didn't stop it at this stage, when it goes to stage 2, the swelling increases twice on the first stage. The increased amount also increases the accumulation of blood around the macula because blood is not reaching the retina. You know why blood is not? Because there is a hole in the blood vessels. Remember, there's a hole in the blood vessels, and then it increases the blood vessel around the retina because it's leaking fluid in the retina. So once the blood is flowing, it doesn't get to the retina, rather it leaks. So now that liquid accumulates around the macula, and blood is not reaching the retina, and it prevents the nourishment. And you can see that that's why you start complaining. Oh, I can't see properly. What is this? Things are appearing too tiny for me, or blurry for me, or you cannot see something very far, you cannot see something very close. That means you have a problem with your eyesight. So you have to find out where the leakage is and stop it, block it, and then clean up all those areas, your macula. So that is stage 2. So let's go to stage 3. Neka, you're welcome. Welcome. All right. So let's go to stage 3. Stage 3. Do you guys have any question on this? We've discussed this topic several times. I have a lot of it, so I'm repeating it for the 4th or the 5th time. So let's go to stage 3, severe non-proliferative diabetic retina. Okay. Now remember, I told you guys we have 2 types. Diabetic retina, okay. Diabetic retinopathy is a progressive eye disease and is classified in 2 types. It is classified in 2 types. We have the non-proliferative diabetic retinopathy, and then we have the proliferative diabetic retinopathy. Okay. Now, I'm going to go back again. I'm tracking back again. There are 2 types of this disease. Retinopathy is classified into 2 types. It have 2 types and then 4 stages. Now, the 2 types are the non-proliferative and then proliferative diabetic retinopathy. The non one refers to early stage. The proliferative one refers to the advanced stage. Okay, the one that has none is the early stage. Now, the one that doesn't have none, the proliferative, is the advanced stage. Now, if you look at the stage 1, okay, it's none. If you go to stage 2, it still has, look at stage 1, is mild, none. Okay, this is an early stage with a little bit of fluid leakage and the swelling of the tiny blood vessels around the retina. Okay, now if you go to stage 2, you see it's moderate, but none also. So these are all early stages. Now, if you go to stage 3, you see it becomes severe now. It starts changing. The conditions start changing. It still become none, but it's severe. As I explained to you guys in stage 1 and stage 2, on stage 3, it becomes severe. It still has none. It's an early stage, but it's still severe. From stage 2 is moderate. And then stage 1 is mild. They are all none up to stage 3. But the stage 3 one is severe non-proliferative diabetic retinopathy. So we have two types. It's classified in two types. We have the non and then the non-proliferative and the proliferative. And then the stages are 4. So you got to understand that. So on the severe, okay, when it becomes severe, for those that have been following me from the beginning of this program, as I differentiate between the stage 1, stage 2, and then the stage 3. Remember, in stage 1, there's a small swelling in the blood vessels of the retina. And that swelling is known as microaneurysm. There's a small, tiny swelling around the retina. And then we have the small amount of fluid leaking into the retina at this stage, because it's mild, okay, triggering swellings of the macula. And I've told you guys the macula is what is located in the center of the retina. Retina is what is responsible on your central vision. Anything that has to do with your sight, whatever you see, whatever you interpret, you read, you can read or you cannot, it has to do with your retina. It controls your central vision. But the macula is located at the center of the retina. I've done a video about it, and if you go to my page, you see, or there's a diagram with somebody's eye, okay, on the cover there. All right, I did in details everything, and in that video I showed you where the macula is located, where the retina is located. Anything that have to disturb your retina, avoid it, because retina is what controls your central vision. Macula is what is located at the center of the retina. That is what captures that image. Anything that have to go through your eye have to go through the macula. Your macula capture whatever you see and then send it to the retina. And the retina send it to the brain and interpret it within seconds and then send it back. So that's how it goes. So for instance, whatever you see now, your macula will capture it, send it to the retina, and the retina send it to your brain, and your brain send it back to you and say, this is what you are saying. It's black, it's red, or white. Okay, so that is how it works. So the macula is located at the center of the retina. Okay, now if you go to the moderate, the stage 2, you see now it becomes moderate. Remember, in stage 1, there's a small amount of swelling around the blood vessel of the retina. Then in the stage 2 of it, there's an increased swelling now of what is happening in stage 1. So let me just make it simple. Whatever is happening in stage 1, if you go to stage 2, it doubles it now. So let me make it simple. Then when it goes to stage 3, it doubles stage 1 and stage 2 combined. So stage 3 now doubles what is happening in stage 2 and stage 1 combined. That's what they call it severe. So a larger section of the blood vessels in the retina becomes blocked because blood is not reaching the retina. So due to that leakage and the accumulation of blood in the macula, it blocks everything. That is when it says, oh, I lost my eyesight. Or I can see with one eye, I cannot see with this eye, depending which of the blood vessel is damaged. Or I can see a small, that's when you start asking people, please, can you tell me what is this? Because now you cannot see clearly or interpret what it is. You start seeing blurry vision. So now at this severe stage, stage 3, the last sections of the blood vessels are blocked, become blocked, causing a significant decrease in blood flow to the retina. Because at this stage, due to the leakage of fluid in the retina, there's an accumulation of blood in the macular area. So the more blood is accumulating It keeps coming up. It comes to an extent that the whole area is blocked. So now blood cannot flow across to reach the retina. At this point, the body receives signal to start growing a new blood vessels. Now, what the body is going to do now is, okay, your body is going to say, okay, now, because the brain is sending blood to every part of the organ. It carries oxygen, it carries nutrients and vitamins, what your body needs. Now, when it goes to the eyesight, you say, you know what, I cannot pass through to get to the retina. It is blocked. So what am I going to do? So your body now will start looking for another way to build another new blood vessels away from the one you have to get around the one that is blocked. So because that blood that is flowing must reach the retina. So when those blood cannot reach, it starts trying to see how your body can build another blood vessel to navigate the blocked one to get to the retina. Okay, because blood must reach the retina. So now, at this point, the body receives signal to start growing new blood vessels in the retina. Now it means you have the old retina that is damaged, and then it's building another new one in the retina. Everything is clogged. That is why you start losing your eyesight. That is why it is stage 3. Okay, everything doubles. So let's go to stage 4. Do you guys have any question? So stage 4 now, you see the stage 4 now, it becomes proliferative diabetic retina. Remember, proliferative diabetic this is advanced stage. Now it's not on the early stage. It becomes advanced. So the first 3 stages, they are early stage, but they are mild, moderate, and severe. But when it goes to the last stage, it becomes proliferative diabetic retinopathy. It becomes advanced. Okay. Now, in this stage, if you are lucky, you might still have your eyesight. If you are not lucky, in this stage, as I said, it's either you have your eyesight or you don't have your eyesight. One thing has to give way because it has come to this stage of either you become total blind or partial blind. Now, diabetic retinopathy doesn't usually cause symptoms. I told you guys, it doesn't usually cause symptoms during non-proliferative. At the early stage of retinopathy, the non-proliferative, it doesn't cause any symptoms. So it is possible to have it and not know it. It's like when you have a diabetes, you might have a diabetes without even having the symptoms, and you don't even know that you're diabetic. This is because blood vessels don't always leak into the stages. Okay, so at the early stages, you might have it without even knowing because it doesn't come with symptoms at the early stages. At those first 3 stages, you might have it without even knowing that you have it because it does not come with symptoms. Okay, so many people don't have symptoms until the disease progresses to proliferative diabetic retinopathy at this last stage. That is when you start experiencing the symptoms. Like, oh, you know what, I can't see, my eyes are blurry, or I can't see with one eye. What is happening with me? It's like something is in your eye, and you keep, itching your eye, and that thing is still there. Okay, like floaters. So an eye exam by the care specialist is needed. At this time, you need to see your doctor to refer you to ophthalmologist or specialist who specializes in diabetic eyes, okay, to check your eye, to find out why you are having problem with your eyesight. Now, at this stage, the symptoms at this stage, the proliferative diabetic retinopathy include, let's look at the symptoms at this stage, okay? An increase in the number of floaters, okay? You guys have to go and watch that video that I did. You see behind me, there's an eye there, okay? Because there's an eye there. You have to watch that video on what floaters are. Because on that video, I showed you guys what floaters are. So the symptoms at this 4th stage, there's an increase in a number of eye floaters. Okay? Somebody's going to ask me now, what is eye floaters? Eye floaters are tiny specks or strings that float into your field of your vision. So, for instance, as I said, your macula is located in the center of your retina. So these floaters stays in front of your macula. Your macula captures images, whatever your eye can see, and send it to retina. So what does it do? It goes to interfere in front. It goes and stay in front of the macula and cause you. Sometimes it stays there. Sometimes it move away. Sometimes it come back. So it becomes a nuisance. Okay, it becomes a nuisance to you. I say, oh, I can see something in my eye. I can feel that something is right in the middle of my eye, and you go to the mirror, you can see it. You scream, you try to play with your eye, scratch your eye, it's still there, but you can feel as there's something in front of my eye. So those are tiny floaters. Okay, they sometimes they make you miserable or they become nuisance. Okay, so it can appear as a black or a gray dot or a line or a cobwebs or blobs in front of your macula. Those are what I call floaters. Okay. So the first symptoms of diabetic retinopathy at this stage is called increased number of eye floaters in it. Number 2 is blurry vision. We're talking about the symptoms at this first stage. That is when you start seeing symptoms, eye floaters, blurry visions, distorted vision. Okay. You know what is called distorted visions? Okay. You can't see things clearly, or you can see some. In the same thing you are seeing, you see some part, you don't see the remaining part. They become distorted or disjointed. Poor night vision. At night, you cannot see properly. You know, there are some people when it is night, they can't go out. There's a limited vision at night. But during the day, they can go out. But when it becomes night, they have to be home because of limited vision. Then the other one is loss of vision. It's either, when we talk about loss of vision, it could be partial, it could be total. Decreased field vision. There's a decrease in field vision. When we talk about field vision, is that your focal point, you can only see something that is within your eyesight. Anything that is outside the peripheral eyesight, like on your sides, you can't see it. You can only see something that is in front of you. You can't see something that is aside of you. No, like now I'm looking at this computer now, but I can see things that are on my side, even though I'm not turning my head this way or head this way, but I can see things that are on my side, even though I'm looking forward. But when you have decrease in field vision, you can only see something that is facing you. You can't see something that is in your side, except you turn your head this way or you turn your head this way. So that is decrease in field of vision. All right. Then changes in color. Okay. Changes in color. So these are the symptoms of when you are at this stage of stage 4. Stage 1, stage 2, stage 3, there might not be symptoms because they are on their early stage and non-proliferative. But at this last stage, that is when you start seeing all these symptoms that you have an issue with your eyesight. Okay. Do you have any question? Do we have any question? I see everybody is quiet. Who is who and who is watching? I want to know those who are present. And then we'll look at the next thing I'm going to look at is how is diabetic retinopathy diagnosed. We're going to look at how is diabetic retinopathy is diagnosed. That's what we're going to look at. So we're going to look at how is diabetic retinopathy diagnosed. This is what we are going to look at. So now, to diagnose diabetic retinopathy, okay, your doctor may complete a comprehensive eye exam, starting with your family doctor. Everything starts with your family doctor, and then if you request a specialist, they shift to a specialist. But it's supposed to be so. Okay, it is supposed to be so. Everything starts with your doctor. Your doctor cannot be a general physician. You know, we have general physicians. You cannot be a general physician and at the same time be a specialist. But most of the time in Africa, I see most doctors becomes a general physician and also a specialist. It shouldn't be so. Everybody have their boundary of specialists. You have your boundary of practice. If it goes beyond your boundary of practice, you have to go refer to the next physician. That is how it's supposed to be. So everything that have to do with your diabetes treatment start with your family doctor. Okay. So if you have an issue with your eyesight, you go to your family doctor and he or she is treating your diabetes. And if he find out that you have a visual acuity. That's something like, for instance, we're talking about how diabetes is diagnosed now. Okay, to diagnose a diabetic retinopathy, your doctor may complete a comprehensive examination. This involves measuring your visual acuity, okay, eye muscle movements, okay, peripheral vision, okay, depth perceptions, and then curvature of the cornea. All right, you do a comprehensive examinations. But in most cases, your doctor will likely also dilate your eye to examine your optic nerve and the retina using special eye drop. This dilate is I always prefer to refer you to a specialist ophthalmologist, okay, to do their duty and then advise your doctor on how to progress. When they dilate your eye, I've told you guys about when your eye is dilated. For instance, if you are going to see an ophthalmologist, you're okay. If you are going to see an ophthalmologist, okay, a specialist, your eye is going to be dilated. And I've told you guys there's a process. When your eye is dilated, when you're going for an eye exam and you are going to be dilated, your eye is going to be dilated, you cannot drive to that exam. You cannot drive. You must go with a second driver to drive you home, or you go with a public transport box, or you go with a cab. But if you must go with your car, after dilation, after your eye exam, then you cannot drive for the next 2 hours. You have to stay until that drop clears from your eye. Because within the first 2 hours, you cannot see. Until that dilation of your eye clears, then you recover your eyesight back to go home. So your doctor might likely dilate your eye to examine the optic nerve and the retina using the eye drops. The doctor can also diagnose diabetic retinopathy with fluorescence angiography, which checks for abnormality of blood vessels, growth, or leakage. Now, they will inject a yellow eye into the vein of your arm, allowing the eye to travel through the blood vessels. But all these things are done through the ophthalmologist. I haven't seen any doctor that goes in depth in this. If you're a general physician, you can't do this. You have to send it to a specialist. So that's why I say, when it comes to anything that have to do with your central vision and your diabetics, your doctor shouldn't dive into this area. Rather, refer you to an ophthalmologist, a specialist in that area, to find out why are you losing your vision, take it from there, treat you, and then refer you back to your physician, your family doctor. That's how it's supposed to be. Because if they send you to an ophthalmologist, for instance, send it to an endocrinologist that deals with specializing endocrine disease, diabetes, and other things, or send it to which other specialist am I going to use? Let me just any other kind of specialist. Your doctor have to refer you to those specialists. Once they are treating you there, they are sending a copy of those treatments to your family doctor to have on record. Once your treatment finishes at that specialist, the specialist is going to refer you back to your family doctor, and then advise your family doctor on how to continue from there. Okay, that is how it's supposed to be. So all this process I'm saying about dilating your eye, injecting a yellow dye into your arm that's going to travel to your bloodstreams, all those things can be done with ophthalmologists. They are specialists in that area. So I wouldn't advise a general practitioner to be doing all these things, because he or she is not a specialist in eye exam, especially if you're diabetes. Yeah, they can check your eye, put a light or check. There's something that a family doctor can do to check your eye. But when it goes beyond what he or she can do, you have to refer you to a specialist, especially if you're diabetics. So most doctors are not, most optometrists, they are not specialists in treating diabetics. So you must go to a doctor that knows how to treat diabetic eye. They have the equipment, okay, to take images of your retina, at the back of your retina, everything, and then advise you on how to progress with those treatments. So it is important. But everything starts with your doctor in terms of visual acuity, eye muscle movements, peripheral visions, curvature of the cornea, and then depth perception. The doctor can do those things and then send you to a specialist and continue your treatment there. Once your treatment is done, refer it back to your family doctor and then advise the family doctor how to progress with those treatments. So that is how a diabetic retinopathy is diagnosed. It starts with your doctor. First of all, it starts with you. Once you start noticing that you're losing your eyesight and you're diabetic or something you cannot explain, then everything goes to your family doctor, and then from there, an eye exam is done, or they will refer you. Some doctors don't like taking chances. Some doctors don't like taking chances. As soon as you complain that you're losing your eyesight, you can't see, straight away they send it to a specialist and let the specialist deal with it and then send you back when they are done. Okay, so that is how it's supposed to be. Now let's talk about how to treat diabetic retinopathy. How do you treat diabetic retinopathy? Do we have any question here? How do we treat diabetic retinopathy? The room is quiet. No question from either side. Let's look at how do you treat diabetic retinopathy is what we are going to look at now. Okay. Now, diabetic retinopathy may lead to irreversible vision loss. Once you lose your eyesight, you lose your eyesight for good. No coming back. Okay? So you have to be on top of it. If you're a diabetic, you have to be on top of it, because once you lose your eyesight, that's it. No more getting back. So you must you must stay on top of it. One leg ahead of it. So, but it is treatable. Is it treatable? Yes. If you catch it at the early stages, stage 1, start from stage 1. Don't even allow it to go to stage 2. Start from stage 1. At stage 1, you have various options to treat it. So treatment starts with managing the blood sugar and diabetics. To avoid all these things that I just explained about the classification and the 4 stages, the simple way to treat it, either from day 1 that you are diagnosed as a diabetic, is to control your blood sugar levels. That is the most simplest way to avoid all these troubles. That is the most simplest way to avoid all this complication of diabetic retinopathy, is start with managing your blood sugar and diabetics. That is 1. This includes taking diabetes medications as directed, watching your diet, and then increasing your physical activities. That is the best treatment to avoid all these kinds of complications that comes with diabetics. Once you're on top of it, you're not going to worry about losing your eyesight or having an erector. If you're a man, say you don't have a problem of erection. If you're a woman, say you are losing your libido. All those things is all about managing your sugar level. Then you avoid all these complications of diabetic retinopathy or peripheral vision loss or your diabetic feet. Now, keeping your blood sugar within a healthy rate can slow the progression of vision loss. All right. Remember, even though you are not a diabetic, as you get older, your vision you keep losing your vision gradually. That's why you see that when you get 50, some people, when they get 50, 60, they start using eyeglass. The way your retina, your nerves are not going to be sharp and strong as a child that is 2 years old, 4 years old, 5 years old. Okay. The more you grow older, the more you start losing your eyesight. At the point you have to need an eyeglass to read, okay, or to even watch television. So keeping the blood sugar level within the healthy range can slow the progression of vision loss. Now, other treatment will depend on the stage or extent of the disease, okay, on those 4 stages I've mentioned. There are other treatments. It depends on what stage you are. If caught very early that's what I say, I emphasize again, if caught early before damage to the retina occurs, blood sugar management might be the only necessary treatment. Your doctor will continue to monitor your eyes, though, to ensure the disease doesn't progress again. So everything has to do with early stage. Capture it at the early stage, and then you say, you know what? I'm going to now manage my sugar level very well and avoid further damages to your blood vessels, and then you keep your eye intact. Now, if you are a non-proliferative stage, but experience some eye damage, treatment options might include. So if you are those at the fourth three stage that are non-proliferatives, okay, like mild, moderate, and severe, the first treatment we can use is the laser surgery. We have something we call laser surgery. Laser surgery called for we all know about what is laser surgery. Okay, it's those for those that are going for what do you call it, cataract, okay, or glaucoma. Okay, so laser surgeries is one option. Reduces the drive of abnormal blood vessels and swellings in the retina. So one treatment for this is through laser surgery. Okay, to correct those leakages and the swellings around the macula and the retina. So you can do laser surgeries. Now the next treatment is eye medications. Some of these eye drop you use. Okay, there are some. They can give you an eye drop. It's not an ordinary eye drop because that eye drop contains some medication that can travel down through the blood vessels and the nerves and then correct all those leakages and then block them and then clean up those leaking fluid that is going into your retina. So eye medication, a steroid injection in the eye can stop inflammations, okay, and prevent the forming of new blood vessels, okay, so that those blood vessels can be unblocked and prevent forming new ones. Okay, you might also be candidate for an eye, something we call there's something we call anti-VEGF medication, which can reduce the swelling in the macula and improve vision. Macula is what captures any image. Whatever image you see, whatever you are reading, as soon as you point it towards your eye, the macula captures what you are reading, send it to the retina, and the retina send it to the brain to interpret within seconds. These things happen within seconds. That's why you can see something right away and tell and say what it is. It goes through the macula to the retina, and then the retina goes to the brain. Now, if your macula captures an object and it does not reach the retina, that's when you start having all those blurry vision. Because that's when you start having those blurry vision because it is not reaching the retina. Anything that doesn't reach the retina to interpret, you can't. That's why you are reading a book now, you see that it's blurry. It means what macula is seeing is not transmitting to the retina. It's not touching the retina. You guys have to go and watch that video that I posted about somebody. You see an eye beside me. Read it. You see how the macula captures an image. You see a normal eye and a bad eye. How image is transmitted. So if the macula captures something and it does not go straight to the retina to interpret, that's when you start having blurry vision because that thing that your eye is seeing is not touching the retina. Rather, it is scattering. It scatters. As soon as your macula it goes through the macula, it scatters, goes different direction. It's not reaching the retina, so you find it very difficult to interpret. But you see the normal eye, as soon as the macula captures that object, it goes straight to the retina, touches the retina nerves, optic nerve, and then it sends it to the brain within seconds interpreted. So eye medications, they can use a steroid injections or an eye drop or anti-VEGF medication, which can reduce those swelling in the macula and improve vision. Okay, so doctors can use both of them, either an steroid injections or an eye drop. Okay, now the next one is called a vitrectomy. If you are this one is normally used in the fourth stage. Okay, we call it vitrectomy. Let me put it out there. So we use this. This is the next treatment. We call it vitrectomy. Okay, if you have this one is normally on the last stage. If you have proliferative diabetic retinopathy, you might need an eye surgery called vitrectomy. This surgery treat the problems with the retina and features a jelly-like substance, okay, in the middle of the eye. Okay, now the surgery can remove scar tissues, blood or fluid, and some other vitreous gel, so light rays can focus properly. So you see that when sometimes when you see people, you see blood in their eye, okay, blood in their eye, then you are at this stage. Then they have to do a surgery to remove all those blocked, those eye, all those flu-like symptoms that are leaked into your retina. They have to clean it up. So this always happens at the fourth stage. At this time, traction in the retina and retinal detachment can be corrected. Okay, so this so they can use this as the last option. Everything depends on the stage. Everything depends on the stage. Among those four stages I mentioned, it depends on which of the four stages. Okay. It depends. And then doctor will now choose which way to go. All right. Let me see who is here. Grace, you're welcome. Your vein, it says, can eye drop be used for cataract or it's only surgery? He said, can eye drop? No, you can't use eye drop for cataract. Cataract is a different surgery. Okay, cataract is a different surgery. Eye drop is just for an allergy. If you have an itchy or red eye due to allergies, then you can use an eye. For instance, if you have an allergy, so your eye is itching you due to dust or pollen. Okay. Okay. For allergies, you can use an eye dry, or you having a redness in your eye, you can use an eye drop. It is not used for cataract. Cataract is a different surgery itself. If you have a cataract, you go for surgery to remove it. So it's a different thing. Two different things. It's a two different thing. Okay. Now, what are the ways? Let's look at the ways to prevent diabetic retinopathy. What are the ways to prevent diabetic retinopathy? Let's look at the ways to prevent diabetic retinopathy. Everybody can pass this. What are the ways to prevent diabetic retinopathy? Everybody can pass this. Okay, preventing diabetic retinopathy starts with managing your blood sugar levels. Everything has to start with managing your blood sugar levels. As long as you're managing your blood sugar levels, you can prevent it. This involves managing diabetes and medication, balancing eating what you eat, your physical activities, all those things that have to do with diabetes management. That is how you prevent it. So everything from the beginning, if you want to avoid all these problems, is managing your blood sugar levels. Once your blood sugar levels is within range all the time, it is not going over, then there's no need of you to worry about whether it is non-proliferative or the proliferative or whatever stages. You have nothing to be concerned about. So everything begins with managing your diabetes situation correctly, doing those things they ask you to eat, eating a healthy diet, balanced diet food, exercising, taking your medications, reducing your weight, avoiding all those sugary items. It's all have to do with managing your diabetes. That is the best way I can put it to prevent this diabetic retinopathy. The same thing applies to how to avoid high cholesterol, hypertension, diabetic feet, losing your kidney, your liver. Is all about managing your blood sugar levels. As long as you're managing your blood sugar levels all the time, you are not going to be worried about all these complications. So that is the best way to avoid or to prevent diabetic retinopathy. A healthy diet consists of eating food that are low in GI, vegetables and fruit, whole grains, legumes, low-fat dairy, healthy fat like avocado and nuts, and then fish, salmon, and tuna, all those kinds of food that they say diabetes should consume is what you have to consume. That is the best and simplest way to avoid or to prevent diabetic retinopathy. Right from the beginning, right from day one, you will advise control your sugar level. This is the best way to avoid it. Now let me look at Regina says, I went for an eye checkup last week and was given NADB and some eye drop. The doctor said my eye were okay, but only one pupil is larger than the other. But I didn't know why it was. First time but I didn't know why it was the first time. I also realized. You say you didn't know it was the first time you realized. I don't understand the last part, but I understand. I don't understand the last part that when you say you realize. But I understand. You say you went for the eye checkup, and you're given a D and some eye drop, but one pupil is bigger than the other. But that is observation of your doctor. But you say you didn't know it was the first time. I also realized. I don't understand the last part when you say your first time also realized. Can you expatiate on that, please? But on what they give you for eye drop, yes, they give you an eye drop. The NADB and some eye drop. The question is, are you having any symptoms in your eye? Are you losing your eyesight? That is one. Are you losing anything? And again, when you go for an eye exam, were they giving did they detect any glucose, any sugar in your eye? Did they detect any sugar in your eye? That is the question you're going to ask your doctor. Is there any sugar or glucose in your eye? You have to ask that question, because when they give you NAD and some eye drop, okay, but only one pupil is larger. You can still have sugar in your eye and be okay. What I normally ask my doctor after my eye exam, the first question I'm going to ask the doctor, and I want a clearer answer, is there any glucose sugar in my eye? The doctor is going to tell me no. That's all I want to know. If I go on my eye exam, after all said and done, and when the doctor comes in to talk to me about the result, when he finished explaining everything, I will ask the doctor, is there any sugar in my eye? That's all I want to know. And he's going to tell me no, there's no sugar. At least my mind is settled on that. Okay. I'm going to ask many questions. Did you see any cataract? He's going to say no. Did you see any glaucoma? He's going to say no. These are the three questions I normally ask. Then the other ones he's going to discuss with me about the nerves connected, because he's going to take a picture of my retina at the back. They're going to take a retina. You look into that machine, okay? They will take a picture of the back of your eye. You see your retina, how your retina, all the nerves look like. And he's going to put it on the screen. He's going to put it on the big screen for me. Say, this is how your eye look like. These are the nerves, show the nerves are healthy. These are healthy. Okay, make sure there's no leakage. And he's going to advise you, keep it this way. So, so that's how, those are the three questions I always ask. Is there any glucose in my eye? No. Do you see any cataract? No. Do you see any glaucoma? No. Once I answer all these questions, other things you explain to me, it doesn't matter to me anymore, because these are the three things I want to know. Then the doctors are going to go, they will take a picture, and then they'll put it on a big screen like a TV, and then you see how your retina look like. Okay, it's going to explain to you. You are looking at your back of your eye, the retina, everything. It's going to explain to you the nerves, everything, how good at least you see your back of your eye on the screen, how it look like, tell you what to do, make sure you keep it that way. So it's going to tell you, give you NAD and say it is okay. You can still have sugar in your eye and be okay. So you're going to ask that question, doctor, is there any glucose, is there any sugar in my eye? I want to know, yes or no. So you're going to ask those simple questions. Okay, you're going to ask those simple questions. Did you see any sugar in my eye? No. Is there any cataract in my eye? No. Is there any glaucoma in my eye? No. And then you want to know why he gave you an ID and the eye drop. So I'm trying to figure out why he gave you an IB and the eye drop. Is the eye drop just for allergies to correct, or so I want to figure out why he gave you an eye drop. Okay, and then because giving you telling you is your eyes are okay, fine. Okay means okay can mean a different thing. So you have to you have to make sure you get a precise answer. You got to ask a direct question to get a direct answer. Doctor, do you see any sugar in my eye? No. Did you see any glaucoma in my eye? No. Did you see any cataract in my eye? No. So those three things are the key questions. Because I know, not all African countries. Excuse me. Jesus. All right. So not all African countries have that machine. That is why I always like you guys to go to a ophthalmologist, a specialist in eye disease, diabetes. They have all those equipment. Because I know most African doctors, they will just look into your eye with a light. We call it a vision light. Say, look at your eye and say, oh, it's okay. Okay, but if you go to a diabetic specialist that specializes in diabetes eye, they have those equipment. They don't need to put a light on your eye to see. They ask you to look into that machine. That machine is going to take a picture, everything about your eye, interpret it, and then they go and analyze if there's, because whatever your eye is looking in that screen is going to detect if there's sugar in your eye, anything, if there's ray in your eye, and it's going to take a picture at the back of your retina to see if there's any leakage in your blood vessels. Okay, this is not the one you go doctor say, let me see your eye, because doctor can see it visually. Even I can see your eye visually, but that does not tell me anything. So that is why they send you to a specialist that have those equipment. Okay, you go in there, they take a picture, you look into that machine there, they take a picture of your eye, look, and that machine is going to detect if there's any sugar in your eye, if there's this and that, and then take a picture of your retina and see the nerves. The most important thing is the nerves and the blood vessels connecting the retina. So if I check the patient's eye, if I say, let me see your eye, I'm only seeing your eye, but I'm not seeing those nerves connecting your retina. Okay, so what you said to me here, it says okay, that the eye drop doesn't say a lot, because it doesn't say a lot about this. So anytime you go for an eye test, make sure you ask those questions. Okay, ask a direct question, get a clear answer. Is there any sugar in my eye? That is why you are going for an eye exam, to make sure there is no sugar in your eye. Is there any glaucoma in my eye? Is there any cataract in my eye? No. So you want to ask those pointed questions. Did you see any sugar in my eye? No or yes. So you want to get that direct question, not, oh, it's okay. Okay can mean anything. It doesn't mean anything to me. So yeah, I see. Say it was your first time. I realized that my other pupil is larger than the other pupil. There was no sugar in the eye. Okay. All right. On your pupil, that one is larger than the other. Okay. On the pupil that you say is larger than the other. On the pupil, did he tell you why the one pupil is larger than the other? Did he tell you why one pupil is larger than the other? All right, let's look at other complications. We're going to look at other complications of diabetic retinopathy. Okay. Well, let's look at other complications of diabetic retinopathy. Okay. Let's look at other complications of diabetic retinopathy. So as I said, everything begins to avoid all these complications is all about managing your sugar level. If you have diabetics, it's all about taking care of your sugar level to avoid all these complications we are talking about. Okay, once you control your sugar level, then you are going to avoid all these troubles. If you don't control your sugar levels, then you have other complications like heart disease, kidney damage, nerve damage, Alzheimer's diseases, foot damage, depression, and skin conditions. Okay, so these are some other complications. Now, if you don't take care of all these complications, it might lead you to have macular edema. You guys know about macular edema. I've talked about it in other videos. Retinal detachment. Your retina is going to detach. Your retina is going to detach from your macular edema. Remember that the macular edema is located in the center of the retina. So if the more you allow this thing to keep going, the sugar level keep going high, it goes to an extent that means it has passed the 4 stages. Now you have blood vessels, blockage in your blood vessels, you have leakage in your blood vessels. The next thing, and you have swelling. The more the blood vessels start swelling, the more there's going to be a detachment between your macula and your retina. Remember, the macula is in the center of the retina. That what captures the images and send it to the retina. So due to the swelling and the blockage of those retina, there comes a time that the macula, okay, is going to detach itself from the retina. That means both of them are going to be separate now. So if whatever the image that a macula captured cannot be transferred to retina because there's a detachment in between them because of the swelling and then the blockage of the blood vessels. Okay, and that is why it starts from there. It goes to you start developing glaucoma. You can tell somebody that is glaucoma without even going to see a doctor, because once you're a glaucoma, all your eye is going to pure red. Everything in your eye is going to pure red, like a blood. So you can tell somebody that it's glaucoma by just looking at their eye. You don't need to go and say that when the whole eye is pure blood, pure red, you know that person has a glaucoma. And then, so these are the progressive conditions. Once you align them to go from one stage to another, from one stage to another over a period of time, and that is how gradually you start losing your eyesight. Okay. You tell you to get an MRI. Yeah. Okay. Well, you have to go for MRI. That is why I said, if you go to all those diabetes doctor that have those machines, you can look at it's going to capture all the images, and then you know why your pupil is larger than the other. Then you have to go for an MRI, then go for an MRI, and then find out why your one pupil is larger than the other. Okay. So in general, as I was saying, don't allow these things to linger and being progressive. The more you get progressive from one stage to another, the more problem it occurs for you. So everything have to do with sugar level. Everything have to do with sugar level. If you want to learn more about this topic, go back to my page. I did a video about it. I was, with the same today, you see beside me, there's a human eye. There's a human eye beside me. You watch that video properly, you see there are a lot of images I use to explain these things. You see a lot of images. Which one is a normal eye? This is the retinopathy, diabetic retinopathy, the stages, the retina, all those things is in those videos. So you have to go back again to my page and watch that video from the beginning to the end to understand. Like on this particular one, I don't use any images, but on that particular video, I use a lot of images to buttress my point. So that is going to help you more to understand what I'm talking about diabetic retinopathy. Okay, so you have to go back there and then watch most of those videos to understand what I'm talking about. So at the end of the day, it's all about managing your sugar level to avoid all these complications, all these troubles you're going through. Is right from day one you're diabetic, you have to manage your sugar level. Getting hold of your sugar level will help you to avoid all these complications of retinopathy. Okay, so if the floor is open. If you guys have any question, ask your question now. I'm open to questions. I'm open to questions. So if you guys have any questions, ask me.
What's happened in the last 200 years?
ask your questions if you have any question. Who is here? I know Solo Regina is here. Grace is here. Nneka just announced her presence and disappear. So, do you guys have any question before we call it a day for this weekend? Let me see how many people are here. The floor is open for your questions. If you have any question, go ahead and ask your question. Right. I'm not seeing any question here. Do you have any question? Otherwise, I'm going to let you guys go if you don't have any questions so that you guys can enjoy your weekend. I'm trying to see if there's any question on the other page. If there's no question here. Nalu, do you have any question, Nalu? All right. No question. Okay, Owen, have a nice weekend. All right. Have a nice weekend. I also have to go now. I need to go and do some paperwork on the side. So I'm gonna see you guys. As I said, you guys should go and watch the video. I have the video on my page on the retinopathy to get more insight on what retinopathy is all about. Okay, I use a lot of illustrations on that video. On this, I didn't use any illustrations. So if you want to understand, watch that video and get more of illustrations on that. Okay. So I will thank you guys for today. We'll be here for 1 hour 30 minutes. So tomorrow I'm going to be live again. I'm going to see you guys tomorrow for another session. And then you guys should keep watching the videos and I'm going to see you guys tomorrow. Okay. So enjoy your weekend and then have a wonderful day. Bye-bye. Okay. Yeah.